Welcome to CRH Talk, where we feature rural health professionals and dive deep into prevention, treatment, and building lasting health.
Well, welcome everyone to CRH Talk. We have another great guest with us today, Megan Moss, and she's our director up in our emergency room. And I'm going to have her introduce herself a little bit more, but we have some awesome news that we were just given. And so I'm going to have her go into detail about that. But first, why don't you tell our audience, Megan, just a little bit about who you are and what you do here at Cody Regional Health.
Okay, well, thank you for having me here today. My name is Megan Moss, and I'm the ER director as well as the trauma coordinator here at Cody Regional Health.
Awesome. And I know you've been here now for how many years?
I've been here for about 4 years now at Cody Regional Health.
4 years?
Yes.
Jeez, okay. It goes fast when you're having fun. Because you were a nurse originally, you were an RN in the emergency room, and then you just got recently promoted to the director about 2 years ago?
Yes, about 2 years ago.
Right in the middle of COVID.
Yes, right in the middle of COVID, and
yeah, you've been thrown into a lot, and so she's doing a wonderful job for our organization, and I know your leadership is really appreciated. So, it's true. She's like, okay, it's not just because we're on podcast or TV right now. We're just really excited that you do what you do, and I do what I do.
Yes, absolutely.
Okay, so Megan, I was notified that we had a recent trauma survey and we passed with flying colors. I didn't even know that was something you had to pass. I just thought it's something we did year after year, because we do drills every year?
Yes.
Okay. So can you tell me just what does it mean to have a trauma survey? What does that look like? Because I don't think I've ever seen or have been a part of that.
Yes, so a trauma site survey is conducted every 3 years. We just had ours on June 13th of this year. Basically, the state comes and they look at our trauma program and determine the quality of care that we provide for our community and our trauma patients. The state that comes is comprised of their director. They also have a medical director and a trauma coordinator to come spend the day here at Cody Regional Health. They look at our policies, our protocols, they do chart reviews, they interview our staff, and they also look at our performance improvement, and they determine that, again, we're providing adequate services for our community. And so when we had done this trauma site survey, they had stated that we have done an exceptional job. They found 0 deficiencies, and they will be coming again in 2025 for our next site survey. So it's very exciting for our organization to know that we do provide such optimal care for our trauma patients, especially in such a critical time for these patients. It's nice to know that they have such a fantastic group of hardworking professionals that care about their outcomes.
Yeah, absolutely. I mean, to have 0 deficiencies, that's not really heard of very often, right? I mean,
correct.
I don't know what these things look like, but if you're going around the state, I'm sure that most places would have something to improve on, but that's amazing.
Yeah, they only had just some small recommendations, little things that we could improve, and that's the point of trauma, is to always improve, always look at every little thing that we can do better for our patients. You know, trauma is something that's constantly evolving. There's new, standards of care, evidence-based practice, and so just having those small recommendations of things that we can implement to, again, make that quality of care even better for our patients was fantastic.
Yeah. So what exactly is a trauma that we see a lot around here that you and the team have to be really prepped and ready for? I mean, is there something that you consistently have to deal with, or is it across the board? I mean, what does that look like for your team?
So here at Cody Regional Health, we see quite a plethora of traumas, anywhere from motor vehicle collisions, motorcycle accidents, animal-related incidents and falls. Those are some of our top traumas that we see. And having a trauma is a very coordinated event. It may look chaotic to the standard person, but really we are a well-oiled machine.
I can't imagine someone coming in with a severe wound or something that's been cracked open or broken. And what is kind of the step-by-step process that you guys take? Say, for example, if someone gets attacked by a grizzly bear, because we have that around here, what is it like from the time that you guys get a call? Who's involved in making sure that that patient is taken care of?
So typically when we get a call for a trauma, dispatch notifies us of a potential trauma. Our EMS is fantastic. They arrive on scene. They're communicating with the trauma team, letting us know what to expect, and they're also activating a trauma, whether it be a priority 1 or a priority 2. That's determined by the severity of the incident and, again, the resources that we may or may not need for that particular patient. So while EMS is in the process of resuscitating that trauma patient, we're getting our team ready, meaning we're having our ER physicians, our nurses, our lab, our radiology, our surgeons, our surgical team. Everybody is ready in their position, ready to go when that trauma patient arrives. Even from setting up the room, everything is in a particular spot, so that way we're able to take care of that trauma patient in a timely manner. Again, we're a very well-oiled machine. It may look chaotic to the outside person, but for us, everything we do is very calculated in order to save that trauma patient's life.
I mean, I would think when you're seeing traumas, and I don't know how often you guys have to deal with a trauma. I mean, is it every week? Is it typically once a month, or is it just all over the board?
So almost every day, there can be something as simple as a fall, but depending on that patient's past medical history, their comorbidities, that can be a trauma. We also have a trauma registry, and this last year we put in 213 patients that met trauma criteria, meaning based off of certain codes and the accident that happened. So we see quite a few traumas, again, almost every day. It could be something, as a complex laceration. It could be any sort of a bull-related accident, especially in the summer. When we have a lot of tourists here in town, we see quite a few traumas. So again, it's something that happens too frequently, but we've had enough practice to where we're very quite acclimated to traumas.
Yeah. I mean, I've talked to a few other nurses that are in the ER, and they say you do go through kind of what's called like PTSD. I mean, where you are post-traumatic. I mean, you have to see these things day in, day out. And how does that affect you? I mean, personally, as a nurse and as a director of a department where you have to see this often.
I think it pushes us harder because, we do live in such a small community that we all know each other and we take pride in what we do. We want to make sure that we are keeping our loved ones, our friends, our family, our community safe. And I think as a director, it makes me want to instill that pride and that confidence and competence in our nurses and our team to provide the best care possible. That ranges from education to drills to, updating our policies and procedures, having our committee on trauma meetings, and working with our multidisciplinary team so that everyone is on the same page, ready to provide that great care.
Yeah. What do you do to just release and get out and get away from that sometimes too? Just as a human being having to deal with it, mentally, is there something that you do that, I think sometimes we as just civilians looking at someone like you or someone in the military or someone out there, I'm just kind of thinking, in Wyoming, we have a mental health issue. And I'm just wondering, for someone who has to go through and deal with this, it's probably mentally a little straining. Mm-hmm. Like, what do you do to keep yourself healthy? And you just seem like a really healthy, vibrant human being that, what do you do for yourself that maybe others could take away from?
Well, kind of going back to the traumas, especially as a team, right? We rely on each other. We have a very strong bond in the emergency department because we do see some of the worst things. I mean, these are people at the lowest points in their lives when they come in. And so for us, we really rely on each other to get through. We do debriefings after significant traumas that could potentially put an emotional, physical, spiritual strain on somebody. And so we really take pride in doing debriefs, talking through these situations, really getting it out so that way we can start that healing process. You know, a lot of us enjoy our time with our families, getting out in nature just like everyone else, and really just taking that time to kind of digest some of those emotions when we are dealing with those traumas that can really affect somebody's emotional health. So we do take a precedent on making sure that we take care of ourselves. We have to take care of ourselves before we can take care of others.
Yeah. So you heard that, everyone. They talk about it. They don't just go and deal with a trauma, which is awesome that we passed this survey with flying colors. But I think the reason why we are so successful is because we have a tight-knit team. We trust each other. We have each other's backs. And it sounds like you're an amazing leader that works with a lot of other leaders within this department to make sure that we have a good program. So can't thank you enough.
Well, thank you.
Yeah, I know if I'm ever in a bad situation, milking my cow and she gets a little rowdy, I know I'm going to be taken care of if I get hurt.
Absolutely. We'll be here ready and waiting.
Oh, jeez. Well, everyone, thank you so much again for listening to CRH Talk. We have a couple of new speakers coming on, so we hope that you will join us. And again, if you ever have any questions about our services and what we do here at Cody Regional Health, we are here to answer those. So please reach out, subscribe, like, and we'll see you soon.
Thank you for listening to CRH Talk. Please subscribe, rate, or share this podcast. Check us out at codyregionalhealth.org and see what services we offer locally in Northwest Wyoming.